So a dental implant is referring to the very small screw that we basically put into people's jawbones, usually made of titanium, and it fuses to the bone. And the implant, or the dental implant, refers to that bit of metal screw that will go into your jaw and you'll never see that again. And then that allows us to then attach a false tooth, which would then be fixed in, screwed in, and that would then be your restoration, which is obviously the bit that you want to see. The main benefit of them is that they don't require any support from neighbouring teeth. So the screw that goes into the bone is a standalone fixture that supports the tooth, and it doesn't rely on any neighbouring teeth, and it doesn't put any additional strain on a neighbouring tooth, unlike a bridge. So there's loads of factors involved. Now, implant treatment is a prosthetic treatment, but it's also a surgical treatment. Basically, the healthier someone is, the better. But there's very few absolute, what we call, contraindications. There are a couple of medical conditions or different medications people might take that could have an impact on the success rates and potential complications of implants. But there's very, very few absolute kind of very few medical conditions that absolutely mean you can't have an implant. One of the only ones that we treat regularly is gum disease, periodontitis, that you might have heard of. And that is one absolute contraindication. So you'd have to make sure that any gum disease is completely treated and stable before you can look at implant work. So we never know how much bone is going to be there until we take a CT scan. That's standard for all implant planning. Whenever you take a tooth out, you will lose some bone. Often, if people have had teeth removed years and years ago, you may find that there is, there may be some bone missing. But that's why we take a CT scan. It tells us how much bone is there. It tells us the quality of that bone, how dense it is, and then that's how we then plan from there and decide what procedure is required next. It's very, very rare that nothing at all can be done. In the vast majority of cases, something can be done to correct that. So it can vary if someone comes to us with some teeth that need to be removed. In the vast majority of cases, we'd want to take teeth out and allow things to heal for a month or two first before we get a scan. Once an implant goes in, usually we give that 2 to 3 months to then heal and fuse to the bone, and then depending on the complexity of the restorations, it may be anywhere from a month to maybe 2 or 3 months, worst case scenario, to have the final restoration in place. So typically for someone who comes in with a tooth that needs to come out, it may be kind of 6 to 9 months. Usually it'd be under 6 months if there's a healed site and someone just wants an implant going in. So obviously with all surgical procedures, it can vary drastically depending on how invasive of a procedure that is. It's something that I actually found surprising when I first started doing implants is how little kind of discomfort people tend to have, and it tends to be much less than just having a tooth out. So if you've already had a tooth out, chances are the placement of an implant won't be as bad as that. So in the vast majority of cases, no, it wouldn't have a major impact on people's work life, social life. But obviously it's all dependent on how big of a procedure it is. For simple single implant cases, very, very rarely would be expected to massively interfere. If it's some of the larger kind of full mouth rehabilitations, some people may take a day or two off of work. So there's always a risk of infection whenever you do any surgical procedure, whenever you cut the skin, cut the gum. For implant treatment, it is fairly standard that antibiotics are used in order to prevent, infection at the time that the implant is placed or in the immediate kind of healing time. Implants, they do have complications like any dental restoration. The overall success rate that I typically like to quote is that over a 10-year period, 96% of implants are still surviving, so they're still in the mouth. That doesn't necessarily mean that they haven't had to have some maintenance work along the way. The main two things are either, bits of porcelain or bits of the crown could break. In the vast majority of cases, they can be removed and replaced fairly straightforwardly. There is one major complication with implants, which is periodontitis, which is essentially gum disease around your implant. Now, that can be more difficult to treat than normal gum disease, but that's why it's so important to make sure patients are treated and are stable for gum disease before we start any implant work. So I guess before that 96% over 10 years, that's probably the best evidence that we have, and that basically means that 96% of all implants will still be there 10 years down the line. So in the vast majority of cases, your implant will still be there 10, 20 years down the line. But obviously, if you're in that 4%, obviously you're one of the unlucky ones, but it does vary drastically depending on the type of restoration. So single units, single teeth, tend to last much better than full arches, just because they're a lower level of complexity. But really, it massively does come down to how well they're looked after. You know, in the same way as teeth, the better they're looked after, the longer they last. So eating, you should be able to eat and enjoy the food that you always have done. That's the whole point. We don't want people having to, suffer and not have to have the things they want. In terms of looking after them, for the most part, they can be cleaned more or less like a normal tooth, so with your normal toothbrush, toothpaste. Because, as I've said, implants they're not teeth. They are, unfortunately, nothing we ever do is as good as a natural tooth. I would always say that things that you might sometimes get away with natural teeth, you won't get away with implants. So it's very important that you are using your interdental brushes, your floss, around the implants, and that's something we will show you at the end of implant treatment with one of the hygienists. And there are other kind of more fancy things like the water flossers and stuff, but in my opinion, I think that water flossers are mainly something to help with interdental brushing. I don't think they're an overall replacement. Typically, an implant can look however you want it to look. There are some limitations. Typically, we can make the colour of the tooth whatever you want, the shape whatever you want. There can sometimes be some limitations with regard to the soft tissue, because just the anatomy isn't quite the same as how the body connects with an implant as a natural tooth. But we do everything we possibly can to try and make things look as natural as possible. When it comes to how do they feel, implants can sometimes not feel exactly how a natural tooth feels. Now, this isn't usually a major issue, because we control how the teeth bite together, and the biggest difference with an implant is it doesn't connect to the bone in the same way that a tooth does. A tooth has a soft tissue ligament that almost acts like a bit of a shock absorber and connects the tooth and the bone. So teeth actually have a little bit of movement in them. An implant, on the other hand, is fused directly to the bone, therefore there's absolutely no movement. And that's the main difference there. And when we're fitting your final crown, it's very important that we adjust it appropriately so that it functions harmoniously with the rest of your teeth. So they can feel a little bit different, but when they're fitted, we'd be ensuring that it's as comfortable as possible. So it depends on the situation. The vast majority of cases where there's a small, or there's a small deficiency of bone, any bone can be added at the same time that the implant is placed, and that usually wouldn't add any real time frame. All our prices for implant placement include any bone grafting that needs to be done at the time of implant placement. It is true that there can be more additional procedures that are needed. Sometimes an upper tooth or an upper implant may not have enough space because of the sinus, the air spaces in our cheeks. And in them cases, additional grafting procedures will be required, and this can extend treatment time.